Hi, I'm Dr. Russell B. Jones with Veterinary Institute of Paducah, and today I want to talk to you all about cat declawing and the sensitive subject that it is. I have a lot of information, and I think you'll find it useful in deciding if it's something that you want to do with your cats, or if your cat has been declawed and you're having issues. I think you can learn a lot too. Stay tuned. Okay, so we are here to talk about declawing in cats, and I think the first thing we should do is what is declawing a cat, and that is the amputation of the end of the toe. It's called an onchiectomy, and that's the medical term for it, and it is the surgical removal of the very last bone of what would be your finger or their toe. And that includes the nail. It is an amputation. I think declaw gives it a sense that it's something less than it is, and I think it's important that we call it an amputation because that's a serious procedure for anyone or anything, is having the end of your finger or toe amputated. That being said, I am also for banning declawing in cats. I think there are way too many complications either way, and they can cause lots of behavioral issues in cats, whether it's done correctly or incorrectly. And if your cat's having behavioral issues, I would, and has been declawed, I would listen pretty closely because we might be able to help, but not only give you information. The only option then, I guess, until they ban it, is to do it correctly and the right way. And there's only really one way to do that, and that is the surgical amputation of the claw. I'm going to do some drawings for you guys and show you some actual cat toes. So if your cat has behavioral issues and has been declawed, there's going to be a lot of information for you in this video, and a lot of information on how we might be able to help. I think the first thing we should do is a little anatomy lesson, and then we can talk about how declaws should be done and the best way for them to be done, because there's really only one way. Any other way than that is just really inhumane and not appropriate, in my opinion. So let's jump into some anatomy about the declaw or the amputation procedure and how it goes. So first thing we need to look at is some anatomy of the claw, and we can kind of use a human hand. So you have bones in your fingers or toes called phalanges, and this is P1, goes from about here to here. This is P2 and P3. And the nail comes from P3. And there's lots of cells all over the entire bone where the nail originates from. And that's how it keeps regrowing. So what's happening in a cat, and what the problem is here is, like, if we'll draw it sideways, that's P3, P1, and then a little bit smaller P2. And then they have this weird shape to the end of theirs because they've got this retractable claw. So something similar to that. So that's where the nail is. And so this is P3 in a cat. The goal of surgery when you're amputating this claw is to remove the entirety of P3. You've got to remove the whole claw. You can't leave anything behind. However, that's where one of the cruxes of this problem comes, is that frequently the guillotine method using sterilized toenail trimmers is how this procedure is done that causes the most issues, or has the most issues. So what happens there is that when the claw is being amputated, it has to be in an extended position. So normally if the cat has it retracted, the nail's kind of like this. And that nail is all up in the folds. You can't see it, their foot's like this. And their little beam, And so they're really walking on this bone here and here. But when you amputate, or when you declaw them, you have to extend this claw out so you can get down in this joint. It's impossible to get, and there's so much tissue. You've got to kind of get this out. And so frequently what happens is a piece of this bone is cut when is left when it's cut during the amputation. The thing we have to do in the surgery itself is make sure that we get all of P3. We have to get all of this bone out, and the only way you can do that is surgically. You cannot do that with the guillotine trimmer method. To me, that is inhumane. It also crushes the bone, very painful. And so that being said, the way that I prefer to remove P3 is with our radiosurgical electro scalpel. Basically, it uses radio waves that vibrate the end of the instrument so that it cuts and cauterizes at the same time, and it can't cut through bone. So there's no way that you leave a little piece of the bone behind, because it simply can't cut through that bone. The other thing that we do before this even starts, besides adequate pain control, is nerve blocks. And so in a cat's foot, if we're looking at it from the top, and these are where our toes would be, and then from the back, we have that little nubbin thing up there where our toes would be, and then their dew claw. So we do what's called a ring block. So we inject lidocaine, kind of what they use at the dentist's office to numb your mouth, under this dew claw all across the top of the fingers and toes, and right up under this pad up near their wrist, or what would be their wrist. And that's where all the major nerves come in to supply the toes and top and bottom with innervation, and blocking that helps them have way less pain after the procedure. We don't have to use tourniquets. They have less inflammation overall, and multimodal pain control approach is absolutely necessary with this procedure, because again, this is amputation. This is the removal of 10 parts of bone of your cat's body, and so pain is a significant portion of this. And then let's say we do this procedure perfectly. We still have a lot of issues that can go on. When you're cutting through this joint, you are cutting through muscle, tendon, nerve fibers, blood vessels, cartilage, joint capsules. That's a bajillion structures, and pretty much all of them have nerves. And there is going to be some level of damage to all of those structures that could be permanent, and that can frequently cause behavioral issues. So it is not only imperative that we do it right so that we don't have all of these remnant problems, but we also have to be prepared that if we do it right, or someone does do it right, that we're still going to have these problems no matter what. Okay, so now that we know how the digit amputation works in a feline declaw, I just kind of want to wrap things up with a case that I have and a case that I've helped. I had a cat come in that was having some behavioral issues, and had been declawed several years prior. And so if you look with me at these x-rays that we took of her toes, you can see P1, P2, and P3 is missing here. So that one was completely amputated. But on this side, P1, P2, that's a remnant of P3. And then 1, 2, 3, 4, 5, 6, 7, 8, 9 of 10 toes, we have incomplete removal of P3. Several of these toes had the corkscrew nails coming from those P3 remnants on this cat too during the initial exam. And so here at VIP, whether it is retrieving P3s that were left, or if all else fails and we are still proceeding with the digit amputation, we use our electrocautery surgical scalpel to do this procedure, because it cauterizes blood vessels and nerve endings, so that really cuts down on pain, cuts down on bleeding, which means it cuts down on surgical time. We actually stitch each toe individually, so that bleeding is much less likely to happen at home than just using a drop of surgical glue. Our cats do not have to have tourniquets because of the cautery as well. And so when we're going in there and retrieving P3, all those benefits still apply, and we're able to get those bony pieces out and provide a lot of relief almost immediately. It's amazing how quickly these cats turn around after getting those remnants out of there. I just wanted to kind of recap in that we at VIP fully believe that we need to explore every avenue possible before proceeding on with a declaw. And again, the only reason that we offer it is because we want to make sure that it's done the right way, and that there's an option that you know specifically it's done the right way, it's done the best way that we can, so that we can take every precaution to try to minimize any side effects from the procedure. And if you think your cat is experiencing any kind of arthritis, lameness issues, and has been declawed, maybe even behavioral issues, inappropriate urination, we would love to chat with you and see if there's any possibility that there could be some remnants of P3 in there of that nail, and maybe we can help them. If you'd like to have some chats about declawing in general, we'd love to do that too, and maybe help you change your mind and figure out a way to let your cat keep its claws, because that's always the best option.